For the next drug, which we'll be discussing, is pharmacology. We'll talk about what is known as a Onasemnogene abeparvovec. Onasemnogene abeparvovec. So the brand name of this drug is what is known as Zolgensma. Okay, so Onasemnogene abeparvovec is a gene therapy usually approved for treatment of what spinal muscular dystrophy in pediatric patients. That's mostly in children. Okay, so drug class is a gene therapy. Okay, what is a vector? Okay, what actually transport the drug to the site of action is the adeno-associated virus serotype 9. So what's the gene that this drug has to come and replace what is missing? Is what is known as a SMN1 gene. That's a survival motor neuron 1 gene. Of course, that's a gene that will code for the survival motor neuron protein. We'll talk about what it is. So what happens? The vector, that's the adeno-associated virus serotype 9. It crosses the blood-brain barrier. It transduces the motor neurons. So it carries the gene, right? So that's the survival motor neuron 1 gene. Okay, so it's expressed what? The gene is expressed what? Episomally, and it will start producing the survival motor neuron protein. Okay, so the protein is what will now restore how neurons are surviving in the body and how neurons are functioning. So that's what will now reduce the spinal muscular what atrophy disease condition. So this is how these drugs work. Okay, so pharmacokinetics is just the same thing. The adeno-associated virus will basically take the gene there, and it's a single intravenous infusion and all of that. Okay, so vector DNA eventually degrades, immune responses may limit persistence. Okay, so therapeutic use mainly used in treating what? Spinal muscular atrophy. So it improves motor function. That's basically the effect. Improves motor function, reduces risk of all those respiratory distress. Okay, then what next? So adverse effects can cause elevated liver enzymes, can cause vomiting, and can also cause what? Fever. Alright, so that's what we have for this drug. Let's